Hello, everyone. My name is Cindy Hinson, and I am the Medicare Specialist for Prosperity Partners Wealth Management. I'm giving this presentation today to educate you on Medicare. I would like to provide some helpful tips that will allow you to make the best decisions when it comes to Medicare. So get ready and let's see what it's all about. Medicare. So let's look a little bit about the history of Medicare. In 1965, Lyndon Johnson signed the Medicare bill into law, providing health coverage to Americans aged 65 or older, regardless of income, medical history, or health status, including those receiving retirement benefits from Social Security or the Railroad Retirement Board. In 1972, President Nixon signed a significant expansion of Medicare, and this was to include individuals under 65 receiving Social Security disability payments and individuals with end-stage renal disease. So who is eligible for Medicare? Turning 65, the magic number. You're eligible for Medicare when you turn 65. If you're a U.S. citizen or legal resident for 5 years, if you're under 65 with certain disabilities, or like we said in the previous slide, people of all ages with end-stage renal disease, which is chronic kidney failure. So what do we receive with Original Medicare? Original Medicare has two parts. Part A, which is your hospital insurance, and Part B, which is your medical insurance. Coverage is managed directly by the federal government. And if you are receiving Social Security, you will automatically be enrolled in Medicare, and a card, a red, white, and blue card, will be sent to you. If you are not receiving Social Security, you will have to enroll in Medicare through the Social Security website. Original Medicare is not free. To receive Medicare Part A without paying a premium, you must have worked for 10 years in the United States and paid Social Security taxes. If you have a spouse that has worked 10 years in the United States and paid Social Security taxes, or can be eligible for railroad retirement benefits. For Part B medical insurance, everyone pays a deductible and or a premium for Part B. Standard monthly premium in 2021 is $148.50. The annual deductible for 2021 is $203. Remember, Medicare pays 80% of your medical insurance, and you pay 20%. So if you go to the doctor and your visit is $200, you're going to be paying the 20% of that. So Part A, hospital insurance. How does Part A assist you? It assists in hospice care, blood after 3 pints, home health services, hospital stays, skilled nursing facility care, and surgery. Hospital insurance, Part A. Deductibles for inpatient hospital stays are $1,484 per hospital benefit period. A hospital benefit period is 60 days. If you are admitted and discharged within the 60 days of that benefit period, you will not need to pay the deductible again. If discharged from the hospital on day 60 and readmitted on day 61, you must pay the deductible again. It is possible to have 5 benefit periods in 1 year, which can be very costly and unfortunate. There's no out-of-pocket maximum with original Medicare. Continuous hospital stays. Of course, as we just said, days 1 through 60, you have your $1,484 Part A deductible. If you were to continue past the benefit period, having a continuous stay in the hospital, days 61 through 90, you will be paying $371 per day copayment. For days 91 through 150 of a continuous stay in the hospital, you will be reaching out to your lifetime reserve days. These are 60 extra days of Medicare paid care, subject to a $742 per day coinsurance. When you use a reserve day, Medicare permanently subtracts it from your 60-day lifetime limit. After days 151, after the lifetime reserve days run out, you will pay the full cost of your hospital stay. Skilled nursing care. If you have a qualified hospital stay of at least 3 days, not counting the day you were discharged, you are accepted by Medicare to receive skilled nursing care. Days 1 through 20, you pay nothing. Days 21 through 100, you pay $185.50 per day copayment. Days 101 and after, you pay all costs. Medicare does not cover custodial care. Custodial care is any non-medical care provided to assist people with daily living, eating, bathing, dressing, mobility, sitting, standing, walking, continence, toileting, cleaning, cooking, and sometimes even driving. Medicare only pays for 13% of all long-term care. Medicare only covers what is deemed medically necessary. So let's move on to Part B. What are some of the things Part B can assist us with? Well, they can assist with mental health services, preventative services, doctor visits, outpatient care, home health care, medical services and supplies, for example, like an ambulance ride to the hospital. Part B, medical insurance. The standard monthly premium of $148.50 for 2021 was set by the federal government. Our annual deductible is again $203 for 2021. You can go to any healthcare provider that accepts Medicare. There is no limit on out-of-pocket spending, meaning there's no cap for that year for you. You can go $9,000, $10,000, $20,000. There's no cap. A Medicare tip. There are gaps in your coverage with original Medicare, Parts A and B. Again, Medicare pays 80% and you pay 20%. Part B premiums depend on your income. Most of us, if you file an income tax return, they go by the income tax returns of 2 years prior to you getting Medicare. So if you're an individual and you make $88,000 or less, most of us end up paying $148.50 every month. If you are in a joint income tax, you file jointly with your spouse, it's $176,000 or less, and you will pay that $148.50. But to let you know, it does go up the amount of premium you pay if you have a higher salary. Medicare Part B assists in covering lots of things. It assists in surgeon fees, outpatient care, nursing facility, administered drugs, immunizations, preventative services, emergency room, hospital clinic, lab tests, x-rays, radiology, ambulance, surgical dressings, casts and splints, pacemakers, corrective lenses after a cataract operation, and independent lab tests. But there are a lot of things Medicare Part B does not cover. Most dental care, eye exams related to glasses, dentures, hearing aids, and fitting exams, long-term care, acupuncture, massage therapy, and cosmetic surgery. Late enrollment penalties for Medicare Part A and B. The Part A penalty is 10% added to your monthly premium. You generally pay this extra amount for twice the number of years that you were eligible for Part A but did not enroll. Part B also has a penalty, 10% increase of Part B premium for each full 12-month period, not enrolled but eligible. Remember, this is a lifelong penalty. If you have credible coverage, group health coverage, this penalty can be avoided, and you can delay Part B and then be able to sign up for it at a later date. Again, we talk about that gap. There is a gap. So what do? There is a gap in original Medicare. We can take two paths. Path 1 is a Medicare supplement insurance and Part D prescription drug plan. And there's a path 2, Medicare Advantage. Let's look at our first path. Medicare supplements are also called MEDIGAP. It allows you to go to any doctor, specialist, or hospital that takes Medicare in the United States. This is very important to remember. If you have any sort of specialized medical issues or you need to see a doctor about a rare condition, you will be allowed with a Medicare supplement. You do not need prior authorization from anywhere. And you can travel outside of the state and get medical care without prior authorization and also see anyone you would like that takes Medicare. Also, if you travel to foreign countries, a Medicare supplement is a must. It pays for 80% of health coverage while traveling. It also pays for preventative services such as flu shots, immunizations. It pays for all co-payments, co-insurance, and deductibles for hospitals and doctor visits. The only thing Medicare supplements do not pay for is Part B deductible, $203 a year, and it does not pay for prescription drug coverage. Easy billing. I know we've all received lots of invoices and bills in the mail that we would have to make phone calls to our insurance companies. Well, I would like to say with a Medicare supplement, you have easy billing. You go to your doctor, they provide a medical service, and they bill Medicare. Medicare pays the approved portion of the bill and sends the excess to MEDIGAP. Your MEDIGAP plan pays the excess amount left over according to the plan's terms, and you don't have to deal with anything. MEDIGAP plans are standardized. Plan A through N, they're standardized throughout any private insurance companies that sell them. Evaluating MEDIGAP costs. They vary. Although supplements are standardized, they vary. They're standardized by the federal government, but each private insurance company can price plans differently. All MEDIGAP plans are guaranteed renewable. Regardless of your health, you're guaranteed to have that plan the next year. They're community rated. The area that you live in dictates the price of your plan. They're also issue age rated, I should say. The age in which you purchase the policy can determine the price of the policy. They're gender rated. Unfortunately, males generally pay more than females. This is because females tend to live longer. Sorry, all you males out there. They are attained age rated. Your premiums will go up as you get older, and this will vary amongst insurance plans. But we still remember, you still need a prescription drug plan with a MEDIGAP. Now we're going to path 2. We're switching gears. We've talked about the Medicare supplement. Now let's talk about Medicare Advantage plans. They are called Part C. What do they take care of? They limit your annual out-of-pocket costs, meaning their plans will let you know how much you will pay that year, whether it's $6,000, $7,000, $10,000, $12,000. They're going to have a limit on how much you are going to have to pay. They have preventative services. A lot of people love their Silver Sneakers free fitness. They pay for doctor visits through a copay, hospital stays. They also incorporate prescription drug plans, and they also assist with routine vision, dental, and hearing coverage. Medicare Advantage plans. You will not have a red, white, and blue original Medicare card when you choose a Part C. Your health card will be from the private insurance company you choose. So you put that original Medicare card away and you will use your health insurance company card. Medicare Advantage plans, it replaces original Medicare. They're offered by private insurance companies and the prices do vary. They implement HMOs, PPOs, copays, and coinsurances. Prior authorization is needed with a Medicare Advantage. They offer a yearly maximum out-of-pocket, which we talked about before. They have very low cost premiums, almost as low as $0 a month. They usually include prescription drug coverage and routine dental, hearing, and vision coverage. Okay, now we're really going to switch slides on you, and we're going to start talking about Part D. So we talked about Medicare supplements, Medicare Advantage plans, and now let's talk about Part D, prescription drug plans. Their monthly premiums vary according to your recorded income and chosen plan. Most have an annual deductible and a maximum out-of-pocket. There's 2 ways to get Medicare drug coverage. Path 1 is a standalone prescription drug plan, or Path 2 is a Medicare Advantage plan in which the prescription drug plan is included. Part D payments according to income. This is also like your Part B. They look at your income. If it's $88,000 or less and you have filed as an individual, you will not pay anything for Part D. You will only pay for the plan premium. If you have filed jointly with your spouse and together you guys file and you make $176,000 or less, you too will only pay the plan premium. If you make more than this, they tack on a small amount that you could possibly pay with your plan premiums. I think the highest they go up, it shows with an individual who makes $500,000 or more, they will tack $77.10 onto your plan premium. Prescription drug plans and the 4 prescription tiers. This is very important to you, especially if you're on a lot of medication. You pay for your drugs until you reach the deductible set by your plan. This is your annual deductible, the first tier. The second tier that you will fall under is called the initial coverage. You pay a copay of coinsurance and the plan pays the rest. You stay in this stage during the year until your total drug costs for the year reaches $4,130. Next, you enter that donut hole, which I'm sure a lot of you have heard about. It's called the coverage gap. During this time period, you pay 25% of brand name drugs and 25% on generic drugs. You stay in this phase until your total out-of-pocket costs reach $6,550. Once you reach this point, you are now in the catastrophic coverage. It's greater of 5% or $9.20 for brand. So if you have a brand name drug, you're going to pay greater of 5% or $9.20 for that drug. So your costs drastically reduce. And you also would pay $3.70 for generic. So once you get past that coverage gap of $6,550 and enter into the catastrophic coverage, your prices for medication will be significantly reduced. Then you will stay in this stage for the rest of the year. And then the next year will start all over. Part D also has a late enrollment penalty. You must enroll in Part D within 3 months of Medicare Part A or Part B, unless you have credible coverage through your job or spouse's job, unless you have retiree coverage or you are a Veterans Administration. You're in Veterans Administration, you get Veterans Administration coverage. Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium. So for 2021, that national base beneficiary premium is $33.06. And these premiums change every year. The penalty is 10% a month times the number of full uncovered months you didn't have Part D or credible coverage. Remember that penalties are permanent for Part D prescription drug plans. So enrollment periods. When do we enroll? Let me go through a couple of acronyms that are important to remember. IEP, that is known as the initial enrollment period. This is the first time you can sign up for Medicare. 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday is considered the initial enrollment period. GEP, that stands for General Election Period. This allows individuals to enroll in Part A and Part B, but late enrollment penalties may apply and, of course, increase your premiums. This is January 1st through March 31st, and the coverage starts on July 1st. AEP, we've all heard of this, Annual Enrollment Period. It's the same as Open Enrollment Period, so don't get the two confused. The time when individuals can change their Medicare Advantage and or Medicare Part D plans. This is when you do it. This is also the time to switch from original Medicare to Medicare Advantage or vice versa. It's October 15th through December 7th, and the coverage starts January 1st. Medicare also gives us special enrollment periods. If you lose your credible health coverage from your company, Part D gives us 63 days to sign up for a prescription drug plan. Part B gives us an 8-month period that begins the month after your credible health coverage ends. Special enrollment periods also happen when you change where you live. You have a chance to get other coverage such as TRICARE, PACE, or VA. Your plan changes its plan with Medicare. You get in special enrollment period. Or you're living overseas when you turn 65. And there's many, many more special enrollment periods that Medicare will allow you to take advantage of. So remember, visit medicare.gov to see more of the special enrollment periods you can use. Now, how do I even enroll in Original Medicare? Well, like we have said previously, you're automatically enrolled if you currently are on Social Security. You will get a Medicare card and number sent to you. If you're disabled, you will be automatically enrolled. If you have ALS, you will be automatically enrolled, or if you have end-stage renal disease. Remember, if you're disabled, you will have to receive Social Security benefits for 24 months before they automatically enroll you. But these are the areas of folks that will automatically get their Medicare card. If you don't fall in one of these categories, you need to enroll on your own. You should enroll at least 3 months prior to your 65th birthday. You can register online at www.ssa.gov or by visiting your local Social Security office. You may call Social Security at 1-800-772-1213. If you worked for a railroad, call the Railroad Retirement Board. Their number is 1-877-772-5772. So, in a nutshell, we have a 3-2-1 approach. 3 months prior to turning 65, you need to attend a seminar, or review Medicare information and make a list of your questions, because this is very important. Go to Social Security online. I'm going to give you the website again, www.ssa.gov, and sign up for Part A and Part B. You can delay Part B if you have credible coverage. 2 months prior to turning 65, you need to meet with an experienced advisor to review coverage options and map out a plan that is best for you. 1 month prior to turning 65, sign up for Medicare Advantage plan or a supplement and drug plan. Again, work with a knowledgeable, licensed insurance advisor who will be there before, during, and after you enroll. Here is my disclosure slide. I just want you to know, there are so many options out there that you can turn to for information. Please remember, you can go to some of the sources I get my information from: Medicare.gov, Centers for Medicare and Medicaid Services, and also National Contracting Center. Thank you so much for listening to my presentation today. I hope it helped you with some of your Medicare needs. If you have any additional questions or concerns regarding Medicare, please feel free to call me at 865-690-0049 or email me anytime at cynthia@prosperity-partners.wm.com. I'll be happy to answer any of your questions that you may have. I'm going to connect you now to a link where you can get to my calendar. And if you'd like to set up an appointment, feel free to do that. Feel free to call, feel free to email. But I am here for you for any of your Medicare needs.